It is National Lead Poisoning Prevention Week. And so Department of Health Services co-hosts an event with SDC to recognize the work that SDC and other community partners are doing to make properties lead safe, as well as talking about efforts to prevent childhood lead poisoning in the city of Milwaukee. So today we met with a number of important stakeholders. The health department, the mayor's office was present, as well as other organizations and agencies. And then we came here to this property to actually watch Devin's crew, the weatherization services, work on a property that is being funded through the Lead Safe Homes program.
Over the next 2 years, with the funding that the governor advocated for and that the legislature did sign off on, we should be able to do this kind of remediation work on about 800 homes across the state. And lead poisoning and lead paint is a problem in all 72 counties of our state. It is particularly a problem here in Milwaukee, just given the concentration of older homes and older housing stock.
Yeah, I mean, I think what really got me involved with it is just because we're already doing a lot of...
SDC is working with a lot of great partners, our contractors. We don't really do the work, it's really the contractors. It's really building an economic engine to be able to do the homes, and there's plenty. We noted just by looking at the data of the amount of children that are poisoned by lead, there are a lot of homes that are out here that we need to get at and get taken care of as soon as possible.
Lead can definitely impact the structure of the brain, especially this is really important in young children as their brains are developing so rapidly in these first few years of life. Lead can significantly impact brain development, which can impact social development. It can impact scholarly achievement in school. It also can impact all areas of the body, including the blood, the kidneys, and other areas like that. So it's very important to take this issue very seriously. Also, as mentioned earlier today, and I'll emphasize again that having lead in homes, it definitely is an adverse childhood experience. And the more adverse childhood experiences that you have, it leads to poorer health outcomes later on throughout your entire life.
The children who are most vulnerable for lead poisoning live or spend a lot of time in homes or other places that were built before 1978, when lead-based paint was very prevalent before it was outlawed. And so when children are seen for preventive visits with a family doctor or pediatrician, or maybe even at a WIC center, having a blood lead test done at age 1, at age 2, and other times as well, is our way of detecting whether that level is above 5 and needs special attention, like the abatements you see happening here today.
So this is a root cause issue of some of the things that SDC is passionate about around helping people get out of poverty. So the more we can get this information out to our community, and the faster we can abate the homes that are poisoning our children, not just the people that are living there now, but the next person that comes in, especially in the rental situation. One home can affect 6, 7, or 8 children. And we have to stop this. We have to stop it as soon as possible. I'm excited because I see the city, the state, and the federal government coming together, working with our partners in the community to begin to abate these problems. So it's more than just communication, is action to make sure that we can recover the homes that we live in, but recover them in a way that makes them safe for our children.